Thank you, first of all, for organizing this very nice symposium and for the opportunity to present. Today I want to present some of the research we have been doing and that has been recently published. And I would like to talk to you today about informed consent. And with informed consent, I do not mean informed consent within the context of research, what we all deal with, but I want to talk about informed consent within the context of medical treatment. Okay, imagine tomorrow you are going to your doctor because you have a certain complaint and your doctor offers you a certain treatment. According to courts of law, your doctor is obliged to explain several things to you. He needs to explain to you the nature of your condition. He also needs to explain to you the nature of the treatment that he is offering, including benefits, harms, risks, etc. And on top of that, the doctor also has to give you a number of treatment alternatives, and again explain benefits, harms, and risks. You are then expected to make a decision based on your own free will. And for this, you should be able to, express your choice, what you would like. But you also need to understand all the relevant information that has been presented to you. You need to appreciate the relevance of this information for your own specific situation. And you need to process all this information in a rather rational manner. We can, of course, all imagine that if we go to the doctor with a cold, this is not that difficult. But what if you have a more complex condition? And what if the doctor offers you a rather invasive treatment, and on top of that, a number of treatment alternatives? It becomes something like this. A very difficult thing to do, a bit messy. So in complex situations, it's rather difficult to make decisions then. But imagine how difficult it must become when you have a disease which also includes cognitive impairments. Like difficulties processing information, structuring information, keeping an overview, planning ahead. This becomes a very, very difficult task to do. A disease that is characterized by cognitive impairments, and that is very common, is Parkinson's disease. And this is a disease that spreads very slowly throughout your brain. It is characterized by motor symptoms, tremor, slowness of movement, difficulties walking, etc. But the most debilitating symptoms for patients are actually the so-called non-motor symptoms. These are depression, sleep disorder, and, as I already mentioned, cognitive impairments. These cognitive impairments, they are already present from the very early stages of disease, and they progress over time. They become worse. And they the cognitive impairments that are present are that patients are very slow in processing information. They have difficulties structuring it, keeping an overview, difficulties with working memory, etc. On top of this comes that patients with Parkinson's disease, they are often confronted with rather invasive treatment options. And one of these options is actually deep brain stimulation. Deep brain stimulation is a form of awake surgery. 2 electrodes are placed in your brain and deep down in your brain, and while the neurosurgeon is actually doing this, you are asked as a patient to perform several assignments. And this way the neurosurgeon can very precisely find out whether or not the electrode is in the right position. And you can see this actually very nicely here in this picture. This man is drawing a circle, and this is actually the reason why he's doing that, to see whether or not his tremor is still present, because otherwise you would see quite a shaky line. And with him, it's a rather straight line, so the electrode is in the right place. This surgery has often very significant positive effects, especially on things like tremor. But there are also, of course, negative effects and risks are involved. For example, during this surgery, you are fixated with your head in a metal frame for several hours, which makes it rather uncomfortable. There are risks of surgery and side effects of surgery, and you have to think of things like seizures, stroke, headaches, confusion, but also hardware problems like the erosion of the electrodes that are put in your brain. Once the stimulation is put on, there are also side effects of this stimulation, like very numb feeling or tingling feelings. People can have mood swings going from depression to mania, difficulties walking, keeping balance, speech, And also impulse control disorders like pathological gambling is common after surgeries like this. So if you consider cognitive impairments of Parkinson's disease patients, we wondered whether or not patients with Parkinson's disease are able to make decisions about treatments like this, and whether or not they are able to value other treatment alternatives that are also there. We looked into the literature, and the literature actually tells us, no, they're not capable of making decisions like this. But, and this is a big but, if you look carefully at these studies, what you find out is that they presented patients in these studies, Parkinson's disease patients, with a hypothetical treatment, which was for heart disease, which is, of course, very odd if you think about what these patients have. It's Parkinson's disease, and from a clinical perspective, it's very relevant to find out whether or not these patients can make decisions that are relevant for themselves. So actually, the literature can not help us that well. So that's why we did a study. We specifically focused on deep brain stimulation. And we examined a large group of Parkinson's disease patients and a large group of healthy controls with a so-called medical decision-making test. You can see the scores on the y-axis, and then we looked at different aspects. Starts with a total score, but we looked at to what extent they could understand the information that was presented to them, to what extent they could appreciate the information and reason about it for their own circumstances. We looked at their capacity to reason in a rational manner and also to express their choice in the end. In blue, you see patients with Parkinson's disease, and in red, you see the healthy controls. And what was very interesting, what we found, was that for these last three aspects, appreciation, reasoning, and expressing a choice, there were no differences between these groups. And if you look a bit further, on the total score and on the understanding score, patients with Parkinson's disease even scored better than healthy controls. So, this is a very positive piece of news because it actually means that they are able to decide about their own treatments. And what we think is the reason for this is that patients with Parkinson's disease often live with their disease for many years. And during these years, they regularly go to the doctor, whether it's their neurologist or whether it's their GP. And every time they are, of course, given bits and pieces of information, and they learn about their own disease. And by this, they in a way can compensate for the cognitive impairments that they have. So all this information is very, very helpful, and it makes them capable of making decisions like this. I have to say, however, that we have to keep on monitoring this. Parkinson's disease is a progressive neurodegenerative disorder, meaning that it gets worse over time. And if they are confronted with an invasive treatment option, which is offered to them, I think it's very important to look at that moment whether or not they are able to decide about a treatment like this. Thank you.